Welcome to the Health Leader Forge, where today's health leaders help to forge the leaders of tomorrow. I'm your host, Mark Bonica, of the University of New Hampshire's Department of Health Management and Policy and the Northern New England Association of Healthcare Executives. Our website is healthleaderforge.org, where you can find information about subscribing to the podcast, links and information related to the episode, as well as our complete archives. Today's interview is with Stephen Norton, the director of the New Hampshire Center for Public Policy Studies, a nonprofit policy think tank that provides nonpartisan analysis to decision makers in New Hampshire in both the public and private sectors. In this podcast, Steve gives us a unique insider view into how the center produces its analysis so that it is evidence-based and as non-ideological as possible. Steve also shares his 25 years of experience working in public policy, both at the state and federal level, and concludes with recommendations for early careerists who might be interested in a career in health policy. Welcome to the Forge, Steve.
Thanks, Mark.
So you received your Bachelor of Arts from Wesleyan University. Where is Wesleyan, and why did you choose to go there?
Wesleyan University is in Connecticut, a little town, Middletown, and I chose to go there for the reason that many do, and a friend of mine had gone to Wesleyan.
Good reason.
But I also had applied to three other schools, Williams, Bates in Maine, and Princeton, which my father went to.
Okay.
And for reasons which are apparent to most father-sons, I wasn't probably going to go to Princeton. But I got waitlisted at Williams, which was my first choice.
Okay.
And so I went and I visited Wesleyan again. I fell in love with the campus, and I ended up going there.
Okay.
Yeah.
Your first job coming out of Wesleyan was at the Urban Institute in Washington, D.C. What is the Urban Institute? And talk about how did your education and experiences at Wesleyan prepare you for your role as a research assistant?
I can say without any hyperbole that my education at Wesleyan basically has set me up for my entire professional career.
Okay.
Including my graduate degree. I majored in something called the College of Social Studies.
Okay.
It was a special program that you had to apply to. You got into your sophomore year, and basically it was a seminar-based, ungraded, except at the end of the year in which you got superior, passed, or failed.
Okay.
And
no pressure.
No pressure there. And basically it was every week you were reading some classic piece of political literature or economics literature, and you'd write a piece of work on it, a paper. 5-7 pages, and the professors would review it over the weekend, and then you would have that first couple of days engaging in a conversation about everyone's papers. And so it was an amazing program, and as the years got on, you got more sophisticated, and the topics became more sophisticated, more difficult, and the seminar component became less important, and it became more traditionally a class-based or lecture-based piece of work. And then, of course, at the end, you had to write a thesis.
Okay.
Which is unusual for an undergraduate program. And I met and had some great professors, but the learning how to learn, the learning how to consume information, digest it, and recreate it for others to understand has really been the centerpiece of my work all my entire career.
Okay.
And so I was really lucky because I lucked into it. As those things sometimes happen, a friend of mine was looking at the College of Social Studies and said, you should come talk to the professors. And I really enjoyed it. So in any event, I left Wesleyan, wasn't sure, I had a friend in DC and was reaching out to my network of friends to see where I was going to live primarily. And I ran into former alumni of Wesleyan in DC who worked at the Urban Institute.
Okay.
And at the time, my then professor, Bob Wood, was trying to set me up with interviews with Ralph Nader.
Really?
Ralph Nader was starting a healthcare think tank, if you will, at that time. This was back in 1990. And at the same time, I was speaking with this guy named Ron, who was a Wesleyan alum at the Urban Institute, and I had incredible programming skills because one of the ways I paid for my college experience was I did coding and programming at the Science Center at the university. So I learned how to code, I understood how computers worked, And
did you learn that in college, or did you learn that prior to coming to
well,
college?
I learned that in high school, of all things.
Okay.
Back in those days, that was unusual.
Yeah.
But I learned how to code in high school, and then I used that in college to pay for at least a part of my college education. And the Urban Institute essentially hired me because I was really good at that.
At coding.
And because I had, some political science background, some economics background, and I got
fit for the organization because of that.
That's right, because of the skills.
And you had the
coding. That's right. Yeah.
Interesting.
So, but the story of Ralph Nader is actually kind of interesting because my professor Bob Wood had set me up to have lunch with Ralph Nader, and I did. And I was pretty starstruck, as you can imagine, big name.
Sure.
And he offered me the job to run this healthcare think tank, which seemed surprising to me that they'd put a 21-year-old, but that was the model that he used across all of his issue areas.
A very young,
smart, hungry person. Unfortunately, he offered me a salary that would not have paid my loans.
Okay.
And so had to put that one aside. But I went to the Urban Institute, and the structure there was really fantastic for a young person. You had someone coming in, very skilled in a certain area, obviously very green, had a mentor that was just a couple of years older than me, and that person sort of mentored a whole group of these people who were largely doing coding, work to help the research folks understand what was happening. And the Urban Institute is basically an organization that, across multiple different topics, provides non-partisan information research to the world out there, the policymaking world.
Okay.
So
they didn't bring you in to do issue stuff.
They didn't
initially.
Nope. And in fact, one of the strange revelations I've had about almost every job I've had is that the best person is rarely the one who's trained precisely in the piece of work that you're being asked to do.
Okay.
So that you hire for personality, you hire for the person's talents, you hire for hunger and interest in improving the world, if that's the particular approach you're doing, or helping people in the Medicaid program, or whatever it is. So they hire those types of people, and they hired me for a skill set, and they fit me in where I was most needed. So
you said Nader was looking at you for health. Did you know you wanted to work in health at that point, coming out of college? I mean, or was that just kind of random?
It was. I'm trying to remember I think it was that I honestly, at 21 years old, needed a job.
Okay.
And they put me in.
So it was just luck.
It was luck. They put me into the health policy world and at the Urban Institute. And we had these mentors who were maybe master's level people who managed the relationship between us and the bigwigs, who were the thinkers and the people setting the research agenda and the like. Very quickly, they moved me up into the position of helping manage and create a link between the researchers and the real nuts and bolts of research, the programming of SAS and SPSS and these analytic tools. And I had...
So you moved up into this role of mentor that you were describing, that you had come in and somebody was so fairly quickly. Okay.
Yep.
Okay.
And I think if you ask them why, it was because I had this analytic experience at college that was about information. And so while I was a good coder, I also had the ability to bridge the gap between those analytic questions that we were trying to answer and the work that was being done. And so, but I also had 3 really amazing mentors at the Urban Institute. One was eventually became the director, a guy named Steve Zuckerman, and a woman named Jenny Kenny, and a woman named Lisa Dubé. And they were smart. They understood that I was skilled, that I was also ambitious. And so, but they also really took me under their wing and helped me understand the research process, the set of skills that you need to be successful in defining what a research agenda looks like, and then implementing that research agenda. And I'm still quite close with all 3 of them.
That's great.
Yeah.
So coming in, brand new, you were working on kind of projects. People were giving you things, saying, "Here, do this."
That's right.
Okay.
Yep.
So this was the mentor would kind of parse out the work.
So every week we'd have a team meeting. so that everyone understood what the research questions were that we were asking, where we were in the research agenda, and then we'd go off into our various teams, and people would say, I need you to build this data set.
Okay.
Or I need you to run this set of regressions.
Okay.
Or I need you to bring these two data sets together. Very, very task-oriented. And then when you got up into that or the more of a manager position, it really wasn't. It was just sort of leading a team. The questions became more, how do you bring these different tasks together in a timely fashion, in a way that's meaningful, to help the researcher understand these questions that they're engaging in.
Okay.
And
so a skill set then, kind of at the next level, is trying to help the researcher break down the question.
That's
so
correct.
It's important to understand what he or she is asking, so that you can then kind of
That's right.
break it into manageable pieces.
That's right.
Okay.
And some people never did it. Some people stayed, and there were people, I was at the Urban Institute for 8 years. There were people who came in at the same time I did, who just wanted to be and became better and better and better and more sophisticated coders.
Okay.
And so those folks built models and stayed in their rooms and did their analytic work.
Did very sophisticated stuff.
Yeah.
I mean, I'm assuming so is that a career path?
It was a meaningful career path. And it just, what happened with me was, I was a very good programmer, but to me it was it was enjoyable. I enjoyed doing it, but it was a tool more so than an end in and of itself. And there were people who that was what they wanted to do. They wanted to build out models and use multiple different languages to construct these things that helped research answer questions. But I wanted to eventually ask those questions and be the one who defined the agenda.
So you moved from being a research assistant to a research associate. That's the mentor level?
That was the mentor level, that's right. And at the same time, they asked me if I wanted to go back to school. And so they paid for me to go back to Georgetown to get my master's.
And you got your master's in policy.
I did, yep.
With a emphasis in
health economics.
Okay.
And
so you had decided, I'm guessing at that point you had decided health is something I want to really focus on.
Yes, that's right.
Okay.
And
how did that come about? I mean, other than
I've
been exposed to it a bit?
I'd been exposed to it obviously at the Urban Institute, because by that time these mentor relationships that I had resulted in work on big healthcare policy issues that occurred in the 90s. Expansion of Medicaid program, to pregnant women and children, the Healthcare Reform Act of 1996, which was the last Clinton effort at expanding healthcare. So I'd been exposed to it. I think the reason why I didn't go specifically into, say, a PhD program in healthcare economics was that I wasn't 100% certain that I wanted to be health policy focused, all of my focus.
Okay.
I thought there are lots of interesting policy topics. There are lots of different ways of thinking about health. So I went into this program. Two really important professors shaped my career. One was a person who taught essentially applied policy.
And what does that mean?
So that means there's policy work, which is you take a data set and you ask an empirical question and you answer that question and you make recommendations off of it. And then there is that applied policy world where you have to make decisions. You often don't have 100% of the information you need to make a good decision. Mm-hmm. And so you have to figure out the 6 or 7 different ways that you can answer this question and triangulate to the right answer.
Okay.
And so this was the most important class that I had, and I'm unfortunately drawing a blank on the professor's name, but she essentially gave us a tool set of 10 different ways of answering empirical questions, so that if that one doesn't answer it, you can do it and use these other methods to get to the right answer. So that's what I mean when applied.
Okay.
And the other important person was Janet Mitchell, who was my thesis advisor, and she and I wrote a paper on the uncompensated care decisions that hospitals make. And it got accepted at the American Economic Society's annual meeting, and I gave a presentation on it. And it was an eye-opener to me about this world of academics, people who are really trying to answer behavioral questions that had gone unanswered about healthcare and healthcare policymaking. And so those two courses helped build an appreciation for this ivory tower and also an appreciation for the use of many different techniques to do applied work.
Okay.
And so I carried both of those with me, and strangely enough, what happened next was the Urban Institute was funded to look at something called the New Federalism.
Okay.
Which was what they felt, or what the funders felt, was a effort on the part of the federal government, which was then thinking about healthcare reform, of pushing or devolving all power down to the states.
In healthcare?
In healthcare.
Okay.
Never happened, obviously.
Right.
In fact, exactly.
And that would have been like Medicare and
Medicaid and mostly Medicaid and some of the long-term care decisions. So this was also the time of welfare reform, when we're trying to let states redefine what they were doing. So I spent a good portion of my time traveling around the country talking to state programs about what they were doing, their efforts at improving healthcare in their communities, how the safety net providers, those providers that provide a significant portion of care to the uninsured, were faring, and how they were dealing with the evolving world of Medicaid and healthcare.
Can you give an example of what a safety net provider, what does that mean?
So there are hospitals, there obviously in the hospital industry there are for-profit hospitals, HCA hospitals and the like, and then there are a whole series of nonprofit organizations that play different roles. So anyone who provides a disproportionate share of their care to low-income or challenged people, and often they're urban, and so I would travel around to Miami, for example, and in Broward County you'd see 5 different hospitals in that community, one of which cared for 40 or 50% of the community's uninsured. That would be a safety net provider who's a provider of last resort.
Okay.
And that was fascinating stuff. And in fact, that shaped where I was going to go next. By 8 or 9 years, I decided that it was time for me to move on. And by that time, I was beginning the outlines of a family. And we made a decision, my then girlfriend, now wife, to either go to the Northwest or the Northeast.
Okay.
And it was at her discretion. And because I could take my skills anywhere.
Sure.
By that time, I was well known in the health policy world as having expertise in a couple of areas. And I was young enough that I wasn't going to be too expensive for somebody to pay for to work. So
that's a benefit.
It was a benefit. It is.
Job, right?
It is. And my wife was, of the two of us, she had a more specific skill set, but probably she was the more employable than I was. And so we looked at in the Northwest. We looked mostly in the Northwest at first, because I think I wanted to go experience a different part of the world. And she got a couple of job offers that were okay. And then one day we were in Montana, she and I got a phone call from the governor's office here in New Hampshire. And my resume had been floating around.
Okay.
And they had seen that I was a New Hampshire native and said, we think you should come and check out a couple of jobs here.
Now, had you floated that to them, or had this just kind of
came
made
out
it
of the
through
blue?
Your network?
Made it through the network.
Okay.
And these days, that happens like that.
Sure, with
electronics. Yeah. To this day, I'm not exactly sure how they got a hold of my resume, but so 2 weeks later, we had flown up.
That speaks to just doing good work and getting
That's
known,
right.
right.
That's right.
Yeah.
That's right. And half the problem is just showing up, as they say. And then things happen so fast that there was a job at Health and Human Services here in New Hampshire in the Office of Planning and Research. There was an opening in the governor's office for my wife, or maybe it was that there were offerings. In any event, we both had a job to fall into.
Very nice.
And so a month after we had the initial conversations, I moved here.
Wow.
Yeah. No kids, very little material things made it easy.
That easy. Yeah. I remember those days.
Mm-hmm. They are now gone for me as well.
Yeah. So what made you decide, hey, I think it's time to make this jump? I mean, you were obviously doing well at the Urban Institute. You were becoming well known across through that organization.
Yep.
What made you decide, hey, it's time for a change? I want to look at something different.
One of the great experience, one of the many things that came out of going to states and talking to individual people and the folks that were actually trying to get things accomplished on the ground level, was that I learned that the think tanks that are doing publishable work are not often providing information in a way that is useful to those that are actually trying to create programs at the policy level.
Okay, so a little more theoretical as opposed to applied.
Exactly.
You were talking about earlier.
Yep.
So you were thinking after your master's degree that maybe you wanted to do something a little more applied.
I did, and the Urban Institute gave me a chance to go learn. And then I thought when I left Urban, I thought I was going to go to a state, learn about what it means to be embedded in a policy-making structure, and how you bring this information into the policy-making structure. I'd certainly read enough books about it. And so, with an eye at the time to bringing 4 or 5 of my close friends around the country to build a management consulting firm.
Okay, so long term,
the idea had been, let's learn about what it's like to actually have to help these communities make policy decisions, and bridging the gap between the ivory tower and the guy on the street, woman on the street that's making the policy decision. So a bunch of us went off and did these interesting jobs. And for me, working with in the Office of Planning and Research, I certainly learned about how you create information, use information internally, and use that also with the legislature and other policymakers to try and move things forward.
So this was your first job. So you actually did wind up taking the job with the New Hampshire state government in the Office of Planning and Research.
Yep.
So what is that organization? What's its mission?
So that organization was created to help the state craft a 10-year health policy plan.
Okay. And
it was designed as an organization also to provide the Health and Human Services leadership with an understanding of the policies, the activities that were going on across the country, the policy initiatives that were occurring in various regions within New Hampshire, and bring that back together to make it a cohesive whole. Activities were funded at that time by the federal government and to some extent by the state government. It was run by another important mentor, a woman named Lori Reel, who was my boss and took what she would say a very ambitious, quote unquote, hotshot from Washington and helped him understand how to fit into a world that was a little different than the Washington world. And I think that was one of the important things that she did, was really help ground me in the world of state government, and how you improve is as much about relationships and having people trust you as it is about your ability to analyze 1,000 lines of code, or help them understand the latest research on the uninsured and the behavior of the uninsured. So
sure.
So anyway, that was that job. And what happens, this is the state government is an amazing path for a young person, because I would argue you get much more responsibility than you deserve, and you get accelerated through the hierarchy much more quickly than you probably deserve as well. State governments, for a variety of reasons, have been starved for talent, and they don't pay very much.
Right.
And so a seasoned veteran in applied policy is probably not going to go into a state job unless they're at the end of their career. So I've seen many people get a degree in management, a degree in government relations, a degree in communications without going to school, but simply by going into this organization where you had to learn those skills or fail.
So you're saying a metaphorical degree.
Yes, exactly.
Right? But it's a real learning ground.
It is a learning ground.
Yeah.
And it was for me. I had 3 roles. One was the role that I came from, which was essentially building a think tank within the state government around health policy, which I was very comfortable and capable of given the skill sets that I had. The second was running all of the Health and Human Services information management. That was the Office of Knowledge Management that I worked for, and that I went from running a very small planning activity to a bunch of employees and having financial responsibility for the entire reporting system of the state. And then what that did was expose me to high-level management within the Department of Health and Human Services, the ways in which the organization was connected to itself and to other organizations. And then I began to participate in these very high-level policy decision-making meetings and conversations, which then ultimately led me to run the state's Medicaid program, which is, $500 million health benefit. Yeah. And here I am, a kid, running a very, basically the state's second or third largest health insurance plan.
So just to back up for a second, you came in initially as what was your initial role? An analyst?
I just was an analyst, yeah. Okay.
So, and then your mentor was running the office at the time.
That's right, yep.
She left?
She moved into another role in the organization, and I basically took over her role. Yep.
Okay, and you had 35 employees?
Yep, that's right.
Now, you'd performed a kind of mentor kind of role prior. Had you been a supervisor?
No, I'd never been a supervisor. Okay. I had never managed people.
Okay.
I had never had financial responsibility for my own unit.
Okay.
And I'll tell you, how many books did I read in that first 90 days?
Okay.
Where I was trying to figure out how my personality was not necessarily well suited to management, because I was brusque, and sometimes that works as a management style, but not often. Very focused, task focused. And when people were doing things more slowly than I would do them otherwise, I would do them, which you can't have in a management structure. You've got to allow people to develop the skills and do them at their own pace, and you've got to help them improve. Those are all things that I'd never been, asked to do.
Right.
And I would say those poor people who were my first managees. Yes. But you get better at it over time, and you.
Did you have a mentor that anybody you talked to say, hey, I'm new to this, or did you largely try to do it on your own? And
the management piece, it's interesting. It's the one time in my career where I didn't have a good mentor on the topic.
Yeah.
And I guess that's interesting. That is something I did largely on my own, and did not have that person that I would go to once a week or twice a month and say, I've got this, that, and the other thing I'm trying to manage, and I'm baffled by this behavior, or how do I build myself into this structure in a way that's supportive of those folks but also gets things done. I didn't have those conversations. It was largely learning on the run, I guess.
Yeah.
Huh. Fascinating.
So you talked a little bit about kind of the transition from being an individual contributor to being a manager, and it's challenging to kind of let that go.
Challenging was not the word for it. It
Yeah.
was just, it was painful. And, organizations, human resource departments really need to make sure that they have supports for individuals that are making these types of transitions. And, as I said, there's no other organization outside of that particular one that would have given me the opportunity to jump that quickly without training, without experience. And so it was rough. I spent a lot of nights trying to catch up, trying to understand how to work with people, how to create environment that was nurturing, but also had to meet the demands of the job, and all of that within a collective bargaining agreement and a structure, which was sometimes hard to understand and hard to move around in. So I spent probably the first 6 months understanding my capacities, things that I had to learn, building out what was going to be my management style and management approach. And
obviously fairly successful though at the end of the day, because then, as you were mentioning, you were promoted up to run the state's Office of Medicaid business and policy. So what does the Office of Medicaid Business and Policy do in the state?
Yeah. So when you think about the health policy constructs in the United States, they're obviously Medicare, very big part serving the elderly and the disabled. There's Veterans Affairs that is doing the service for veterans. And there is Medicaid, which is a state federal partnership to cover low-income individuals for their medical care, for the disabled, and for long-term care for those with permanent mental or physical disabilities. And this office has responsibility for the medical management of all those people who are eligible for the Medicaid program.
Within the state?
Within the state, which now is 140,000 people, and that time was probably around 100,000, I don't remember the exact number. And so you had financial responsibility to the legislature, you had financial responsibility to the commissioner, obviously, who was my boss. You had policy responsibility to the legislature. You had a matrixed management approach to the Medicaid program because lots of the money I had responsibility for, but a lot of the policy issues were managed by others.
Others meaning within the state?
Within the state.
Okay.
So the complexity of the management issues quadrupled.
Can you give an example of this matrix policy shared arrangement?
So I had financial responsibility for the management of the medical component of the benefits offered by the state. That would touch on the services being provided by elderly and adult services, so there are long-term care nursing home services, home and community-based care services. Those people are also using medical care. And so how do you make sure that the policies are appropriately intertwined across these two different organizational units?
So your organization did not pay, for example, the monthly bills for somebody to stay in a nursing home?
No.
But if they went to see a doctor as a result of falling or something?
That's right. Or they had to have some drug that would help them manage their diabetes or their hypertension, and it wasn't on the formulary or wasn't prior authorized. So the complexity of it was, I think that was the most difficult piece of it for me to understand. So basically it was my first experience with a job that required me to have matrix responsibility, so that I had no financial responsibility, but I had programmatic responsibility.
Okay.
And that requires an entirely different set of skills for managing than an organization where you're the boss and everyone else reports to you. So it was an interesting process. I'll have to say, though, that the best part of that job for me was actually meeting people who were receiving services or were in some way trying to negotiate with us about care. And I'll give you an example. There was a family whose mother had had a stroke, and my prior authorization director had said there was no medical reason for them to have these sets of rehabilitation services. And there's a normal appeal process for prior authorization and the like, and those often come back to the Medicaid director for discussion and conversation. And in some instances it's pretty clear cut, and in others not so much. And so in this one instance, I actually engaged with the family around what their mother's needs were and really opened my eyes to how bureaucracy interacts with the people that are its consumers or its customers. And that was my first experience with that, and it has built into me and my approach towards almost everything I do a focus on the actual end user of things much more than it did in any other work that I'd done. And of course, that anyone who goes through a management class or management degree learns that in school.
Sure.
I learned it as the Medicaid director.
Sure. And you actually told me in a prior conversation that someone had given you that advice to set aside a
portion of the day if you can, so that people can directly access you. Because, and by people I mean the folks that are using your services or really anybody. And this was a mentor who said, no matter what the business, if you lose contact with the users of your services or the customers, or if there's a barrier in what they will say to you about the quality of what you are doing, then you've lost an enormous opportunity for gathering information about how to improve your business, whatever it is, whether it's providing information to the legislature or providing medical services to Medicaid clients or building widgets. There's that quality feedback that bureaucracies get in the way of. So this mentor of mine said, put aside a portion of the day, which I tried to do in the morning, where there was no barrier, that you could get me on the phone, and it was very, very much a learning opportunity for me.
What do you think you really brought to the table in that job, based on your prior experience, that maybe kind of made you uniquely well qualified to take on the role?
Well, I had very strong policy experience nationally. I had strong connections to the national world. I had very good relationships with the legislature.
And how did that come about? That's a state. I mean, it's in the state.
It is in the state. I think in some of my previous roles, I had to engage with the legislature about policy, about information, and I think I developed good, strong relationships with people across the spectrum of policy issues, but also of the political spectrum. So Republicans and Democrats both felt I was an honest broker of information and policy.
So your experiences while you were an analyst in doing the research work kind of established those relationships, so they trusted you when you moved into this role.
That's correct.
Okay, good.
And so I think that was one. I had a strong sense of policy. I worked an awful lot, and I think I had, at that time, I had a 1-year-old, very young family, so the commitments outside of my work were still fairly limited. And so, I remember engaging with various people at 1 or 2 in the morning and 4:30 or 5 o'clock in the morning,
Wow.
On opposite ends of sleeping. So that was, I think, something that, you bring to the table, is that kind
Sure.
of bandwidth.
You don't often expect to hear that from a state employee,
Well,
which is what you were at the time.
I was, and people, I have met in the Department of Health and Human Services and state government people of incredible skill and capacity and compassion, and the opposite. And I've also had that experience in the for-profit world. I think that the exposure that state workers face is so much greater than the exposure of the for-profit community, and that my experience in the for-profit world is absolutely limited. So I don't really know what I'm talking about, but certainly my friends who are in management positions tell stories that are similar to the ones that I would tell about the state environment. So you think about one of the most important lessons I learned about really communications and marketing. I can't tell you how many times someone said, well, I want to have a well-functioning, efficient Medicaid program. And I would turn to them and say, well, then why would you pay the Medicaid director $80,000 to run a business that in the for-profit world would bring $350,000, $400,000 a year in salary? To some extent, you're going to get what you pay for. I would say, in the past, without, again, hyperbole, I was plenty smart, but you put a 34-year-old individual without a management degree in charge of a $500 million health benefit program. And that's because of the nature of how state government pays people, more so than anything else.
Okay. So you did that job for about 2 years.
Yep, 2 years.
You made the transition in
Yep.
2005. You
Yep.
left the state government and
Yep.
took a position as the executive director of the New Hampshire Center for Public Policy Studies, which is where you are today.
That's correct.
What is the New Hampshire Center for Public Policy Studies, and what does it do?
Yeah. So it was established back in 1996 because there was no source of unbiased, nonpartisan information about state budget policy issues. And it was established by the New Hampshire Charitable Foundation, a community foundation, the Business and Industry Association, and the University of New Hampshire. And it was designed to meet a perceived dearth of information that was important and relevant to good policy making. And that's really been the mission ever since. How this organization's mission is defined by our ability to help policymakers broadly understand issues that are critical to New Hampshire's future in a way that is unbiased by politics or self-interest.
Okay.
And it's an independent think tank, really, is what it is. And it's funded by unrestricted donations, at least half of our budget, and the other half comes from special projects that we do for foundations or in partnership with the Business and Industry Association or the Annie Casey Family or the Kaiser Foundation to answer some particular public policy topic.
So do you have an endowment?
We don't.
Okay.
We don't have an endowment. And we're really sort of an unusual organization in that we don't take partisan contributions.
Okay. So you wouldn't take a contribution from the Democratic Party?
We would not, unless I might if I were also able to get one from the Republican Party.
I see. Okay.
And in fact, there are institutions that are really interested in the center being good purveyors of health policy information, like hospitals, and their contributors, and so I have to make sure that I have the anthems and the insurers that are also contributors so that there's no perception of bias. And my board...
Not just a mouthpiece for...
Exactly. The insurance companies or the hospitals. My board plays a very important role, my nonprofit board plays a very important role balancing that out as well. We've got the former Republican Speaker of the House along with Democrats on our board so that we can both present a face that is bipartisan, but in the workings of the organization, there are constant conflict conversations to make sure that we are not providing any bent. Other people want to put spin on it, go for it. But anything that comes out of our offices needs to be clean of an agenda, particularly a political agenda. It's not an easy place to be. It's right in the middle.
Okay.
And you think about funding an organization like that, people are willing to fund advocacy organizations and others. But this has been, I think it's a gem. I think this organization is very unique to the country even. And so particularly in an environment where you have 400 legislators, 424 legislators.
That's fascinating. I think a lot of people who are not familiar with New Hampshire politics don't realize that New Hampshire, this was something I actually learned recently, is the third largest largest legislative body in the world.
In the world, that's correct.
There's the U.S. Congress,
and
the
Parliament, and then New Hampshire,
and then the state legislature of New Hampshire. That's awesome.
And they have no infrastructure to support them. They have no research capacity. So this really is an important organization to the state, and I have enjoyed the time here. I've enjoyed watching it morph from a one-man organization in 1996. It split off from the university in 2001 because there was a perception of potential bias if we were at the university.
Okay.
2005, I take over, realize that one of the important constituencies for the organization is the business community, so that they can understand important policy matters, because they are often the ones that are telling the legislature what they will accept, quote unquote, and what they won't. So we invested a lot of energy in reaching out and helping the business community understand some of these important topics. And I also recognize that one of the biggest problems with the applied world is still that we do research and it stays on a stump. And you don't take that out there enough to make it part of the conversation that's occurring. So I went from spending 20 to 30% of my time out talking to people, giving presentations, to almost 60% of my time now. Taking the work that we've done, bringing it to a broader audience, trying to help them understand it so that they bring it back in their own policy conversations with the legislature and the like. The other thing that's just fascinating about this place is that it's not just one policy topic.
Right. And this is not a healthcare think tank.
It's not a healthcare think tank. And that is that our interests are broad is both good and bad. All right. That our interests are broad means that we make connections across multiple different topics that have important implications for the state. For example, the question of aging touches everything. Aging of New Hampshire touches everything. And so how do you make connections across multiple topic areas? We're an organization that's uniquely suited to do that because we've had such a broad policy portfolio. By the same token, being broad means that you can't go necessarily as deep as you'd like on every topic. And so it's a constant balance between breadth and depth. But I find it fascinating because it gives me an opportunity to continue to learn new topics, engage with new people, and engage with just a different group of issues. Just, it's fun. I like it.
Just so people get a sense of how big the organization is. It's a relatively small,
very small
group, right?
3 individuals and an office manager. Yep.
Okay. So you don't have the capacity to go into either an enormous amount of breadth or depth, really. I mean, so how do you decide? We want to focus on this topic, or we want to look at, because when you choose one topic, you're going to have to let something else go that probably is interesting and would have bearing.
So we are both proactive and reactive in our decision making. We're proactive at the board level. So in other words, every 3 years, and sometimes more often than that, we revisit the question of the 6 priority areas and how we prioritize them.
So you have 6 priorities. Okay. So what would?
So state budget, corrections policy, education policy, healthcare, those types of things. Local government, obviously can't work on all of them at the same time.
Right.
And so we go back and say, what's the most important issue that we're going to be dealing with as a state? And 6 years ago, that issue was the economy. Okay. All of a sudden, we had the Great Recession, and we decided that we really needed to invest in some time and resources into getting a handle on some of the major drivers of economic activity in New Hampshire and how we're going to come out of the recession and the like. So that's reactive. That's an example of where we were reactive. An example where we're being proactive we've got multiple, but some are in the past when we looked at the issue of dropouts. Our board said that in education policy, this question of dropouts is critically important, and we need to focus the state's attention on this issue, and we're going to invest significant resources. We're going to make it our number one, priority. State budget is always one of our top priorities, because that's a place where analytic understanding is particularly weak outside of this organization, and so we try and stay away from the politics and stay focused on what that budgets actually mean and the implications for the state.
So you perform kind of like a congressional budget office
function? That's correct. That is. I think that's a fair way of describing us. I would argue, we probably have the state's economist function. We have CBO function, which are in other states paid for by the state. In this instance, we raise money to do this work. It's another example of the New Hampshire way.
Yes, okay.
State budget, state is not going to fund it. They want it if you can raise the money to do it.
Right. It's a great idea. You should definitely do it.
That's right. Good luck.
How did you make the decision to make the jump? I mean, it's a natural fit for you given your background, but how did you decide, I'm here, I'm running this major organization, I'm a young man, 34, 35-ish.
Yep.
And that's a big organization with not a great paying job, as you talked about, but one of real importance.
Yep.
And how did it come that you made that jump back over here, back into the policy?
Back into the policy world. So one of the things about being Medicaid director is a very political job.
Sure. Okay.
You've got to manage the commissioner, who may or may not be appointed by the governor. You've got to work with the legislature. You've got to work with your management responsibilities, and you've got to work with the other people across state government who are engaging or touching in the work that you're doing. And there was a point at which it became clear to me that my goals and interests personally were not served by staying at the department.
Okay.
And when it became clear that the then commissioner and I probably weren't going to see eye to eye on the way forward, decided it was best for me to move on.
Okay.
And I think I had, at the time, thought I might go back to state government, because to this day, it was the most challenging, stretching experience in my professional life.
Okay.
But that's a path that has not reopened itself to me.
Okay. Well, you've still got a number
of years to do. Right? That's right.
Yeah. Yep. You talked a little bit about your board.
Mm-hmm.
So tell me a little more about the role of the board, because this is an interesting governance.
Yep.
The management of a nonprofit is very much run by your board, right?
That's correct.
That's essentially your boss.
Yep.
How often do you meet with the board? How often do they give you, is it just every 3 years, you said? Or...
No, so I've got a very active board. We meet 11 or 12 times a year, and they serve multiple different purposes. One, they have fiduciary responsibility for the organization, they have governance responsibility for the organization, and they have obviously the staffing authority to say, Mr. Norton, it's time to hit the road.
Yeah.
They also have an additional role which most other boards don't, and that is they serve almost as an editorial board for the work that we do. They help us understand the work that's going to be important for the state. They help us understand how the work can be best communicated, and they also serve to vet it from a political perspective. Because we've got folks from the right and the left on the board, and oftentimes we've got people on opposite sides of a topic, so that it cleanses it of the potential bias, and you get consensus on a board of how to produce information or whether it's the right information to share, all those critical questions that you have about research and actually having an impact on public policy. And when I first joined, I felt like their input was overbearing and that their management of the organization was at the micro level. And now I believe they are an extra staff person or two, and that I'm just very grateful for their input. And boards, high functioning boards in the nonprofit world can be a huge benefit, but they're hard to construct and hard to maintain and hard to feed. But if you do, you can have a real strong addition to the work that the organization does, not just the governance and the fiduciary responsibility. These are people who have demonstrated an interest in your organization, in your mission. Yeah. How do you bring them more broadly into the fold? How do you get them to be an active worker in this enterprise that everyone around that table cares about? It's been fascinating.
So how does the board perpetuate itself? How does someone come to be on the board? When someone leaves, how does the board pick another member?
Yeah.
Or do you, who decides who's on the board?
It's a collaborative process.
Okay.
We have a governance committee that has responsibility for reviewing and vetting potential candidates, making sure that we've got the right number of board members and that we don't have too many board members going off or coming on. But the staff has the primary responsibility of saying to them, here's the vision for the board. Do you agree, disagree? If you agree, here are 3 or 4 people that we need to think about along down the road for having potential board members, and let's go have coffee with them and talk to them. And then the board gets engaged around these people. So it's staff. Many times we get suggestions from board members about potential candidates, but we have a matrix that tells us the set of characteristics we want the board to have, and when that matrix starts to fail, then we start to try and put people in different spots. And just to give you an example, one dimension of the matrix is geography. We'd like to have a geographic mix. The other is diversity. We'd like to have a nice mix of women and men and those of individuals of color. Or we also like to have a political balance, Republican, Democrat, Independent. So yeah, that is the least sexy part of nonprofit management, but arguably one of the most important parts of nonprofit management.
Interesting.
Yeah.
Okay. What would you say have been your major contributions, or the center's major contributions over the last, during your tenure?
Yep. And
kind of what are you working on now that's really exciting?
I think probably the single most important thing the center has done over the last 5 or 6, 7 years is focus people's attention on the fact that we are a state that had incredible tailwinds for 30 or 40 years that helped across almost every policy dimension. That tailwind was a highly educated workforce and jobs migrating from the Massachusetts metropolitan area into southern New Hampshire. Fastest growing economy, fastest growing state, all those monikers were true, but probably not because of the policy decisions that the state was making. In the last 6 years, we've demonstrated across a variety of different dimensions that we're going to have to start engaging in a policy conversation in a different way than we've done in the past because we don't have the advantages that we've had in the past.
Is that because New Hampshire had comparative advantages over Massachusetts,
That's
basically?
correct. That's correct.
Okay. Friendlier business environment? Or
slightly friendlier business environment, better schools, quality of life. So what does that mean? That means that, in the gubernatorial debate, our paper, which was tailwinds to headwinds, was a centerpiece of the LaMontagne-Hassan discussion in the first budget. And we as an organization are very proud of that. That was a product that was staff, board, everyone was engaged because it was going to be controversial to say that this great place that everyone loves has really fundamental structural problems that are going to have to be dealt with now. And we haven't had to deal with these in 30 years. So that was one piece that I think was really profoundly important for the state. And then when you ask other people about the work the center has done, probably one of the most important pieces of work we did was to support some analysis of expanded gambling with the Governor's Commission that was established to review gaming in New Hampshire. And that was a place where you can imagine it's very hard to get information that's unbiased. And we withstood enormous pushback from both the pro and the anti-gambling people in the state of New Hampshire when we released our report, which said, yes, there are economic benefits. You have overestimated them by a magnitude of 1 or 2. And yes, there are costs. And by the way, anti-gambling people, you've overestimated them by an order of magnitude. So what we did in that work was eliminate the hyperbole and allowed the real conversation to go forward, which is, do you think New Hampshire should have expanded gambling or not? And so those are two really important pieces of work that we've done. What am I personally, do I think that my contribution has been? I think when an executive director comes in to a new organization, you've got an opportunity within 90 days to 6 months to figure out, are you going to try and do something differently? Because generally you'll have an opportunity as an incoming person to provide a different vision. And the vision that I shared with you earlier was, as an organization, we needed to spend more of our time out in the community, and we needed to engage more effectively with the business community. And I think that's personally the vision that I brought that shaped the organization and shaped our ability to influence policy, which is ultimately the goal of the organization.
Okay. Well, let's shift gears a little bit and talk generally about the field of public policy, which is kind of it seems like your true passion. Yeah. You've been involved in public policy for going on 25 years now.
Yikes.
How has the culture of policymaking changed during your career at the national and state levels, from your perspective?
Yeah. So, well, that's an interesting question. So it's definitely changed in a funding perspective. So public policy is still driven by what the federal government is paying to understand, what the major foundations are paying to understand, and what the political environment is demanding. So the topics of interest have evolved and changed, and in the 1990s, it was a focus on low-income women and children in health policy and Medicare decision-making, and all the funding was focused on that. So, the research, the policy implementation, grants, everything. That's changed fundamentally now. And you think about in the health policy environment, what are people funding now from a public policy perspective? Well, right now, we're just mostly engaged in a constitutional question about whether the Affordable Care Act is constitutional or not.
Yeah.
So just the nature has changed, and the funding and what people are funding and trying to understand has changed pretty considerably. I would also argue that just as newspapers have had to change the way they deliver information, the biggest change, I would say, in the public policy world is how organizations like mine or the Urban Institute or Brookings or Heritage or anyone serve and communicate information to the policymakers. if you had come into my office 10 years ago, you would have seen 15 bookcases. And on those 15 bookcases would be 5 or 6 copies of every paper the center had produced. Now, if you walk around our offices, you will not see one. Is that a good thing or a bad thing? Don't know, but it's fundamentally changed. The products have changed, the way it's communicated has changed, and I'd be interested to see whether we're more effective or less effective at actually helping people understand public policy.
Technology has evolved. Everything is on your website, or you've got social media presence, blogs and whatnot. Right?
I mean, if you were to ask, the average person out there where they get their public policy information from, a long time ago it was television and to some extent radio and newspapers. And you ask the policymakers over at the legislature, you say, where do you get your information from? Same thing. Now you ask them, where do you get your information from? And they say, we've got so much information, I don't know. It's just flowing at them at a rate that is overwhelming. And I think one of the critical public policy questions going forward is, how does the industry evolve so that we become curators of the right information? And I don't know that any organization has done it real well. Brookings has done it, tried to do it. Where is the place that people can go where they will get the small pieces of information they need, but where that information is real as opposed to a soundbite, and allow you to dig down into the policy questions if you have interest or not. And newspapers went through that in the last 15 years. And if you look at the online presence of New York Times now, it's unbelievable. The information, the analytics, the reporting, policy is trying to figure out what role it's going to play going forward. And then I would say there's a degree that the political environment has made public policy work really hard. Actually moving something outside of the political rhetoric is hard and has become harder.
Different.
Yeah, okay. That's harder.
How has health policy specifically changed in your career? Any different than the rest of the environment?
Yeah, no, absolutely it has. I would say that for the first 20 years of my career, it was proactive. So in other words, the work I was doing was trying to help organizations set agendas. Back in the early 90s, I did a lot of work on physician payment reform. Mid 90s to late 90s, it was how do you help states make important decisions about public policy. I would say in the last 5 years, at least since 2008 and the signing of the Affordable Care Act in 2010, public policy has almost been completely reactive to the changes that have been put into place by the Affordable Care Act. And I think that'll be what we end up talking about for the next 5 years or so. And if you use Massachusetts as an example, which went through this before, health policy in Massachusetts has largely been about responding to these huge structural changes that have occurred as a result of their implementation of their similar Affordable Care Act-like program. Going forward, what's health policy going to look like? I think it's going to be a lot about the structure of the industry. You're seeing the changes that resulted from the expansion in health insurance coverage associated with the exchanges and Medicaid expansion and the movement towards accountable care organizations. Now you're hearing about Aetna and Humana and Cigna and Anthem merging and creating much larger organizations. What does that mean for the healthcare industry? Hospitals merging, vertical, horizontal integration in ways that we haven't seen since the Great Steel days, when you had huge monopolies that were being established to produce scale and capacity and outcome. I think that's going to be a big piece of the puzzle, including antitrust issues associated with the creation of those accountable care organizations. And I think we're going to be looking at those things for a long time. In the short term, people are going to say, is this a success or a failure? That's the big public policy question about in health policy right now, the Affordable Care Act.
Okay, great. So this is a theoretical question that I'm curious what your thoughts on. Is it possible to separate good public policy research from ideology? And I know you've talked about how the center is supposed to be neutral. But it seems to me that there's got to be some ideology embedded, perhaps, in the choices you make about how you pursue the analysis, the questions you choose to look at.
Yep. So remember we make our decisions based on a board that's balanced politically, geography, men, women. So theoretically, we've crafted an organization that is going to answer the question, if you move ideology aside, what are the most important issues that New Hampshire faces? And can we add some value to this conversation going forward? So theoretically, I believe we actually do come fairly close to separating ourselves out. There's certainly things that I would like to look at because I'm interested in them that the board has disagreed with because they don't believe that it is important enough for the organization or for the state. Now, I think there's a bigger, more important question that your question leads to, and that is, can public policy change a person's ideology?
Okay.
Public policy analysis. And I've learned that belief is a really strong power. And making someone curious about their own beliefs is the single hardest thing to do from a public policy perspective. And ultimately, our ability to make people think curiously about their own positions is where we will succeed or fail. That's where I succeed or fail.
Why is it? Why do you think it is that it's so hard to get people to challenge their basic beliefs?
I'm reading about it, the psychology of it now.
Yeah.
I am. I know. Because it is, it's human nature to believe you're right.
Sure.
And can you challenge your positions that are based on an ideology as opposed to the facts? Now that's one dimension. And I'm just thinking now of another dimension, and that is the moral dimension. That there are folks who have said to me, in the context of trying to help them understand the policy question, Steve, thank you, but I just don't care. This is the thing that I believe is right to do. You can tell me that there are financial implications of this public policy change down the road. I just don't care, because I think the moral imperative is that we do them.
Okay. So something like gay marriage, for example, might be a...
Yeah, and you'll notice that we touch none of those issues that are ultimately morally based.
Okay.
Because those debates are largely about what people feel and are not necessarily informed by information.
You've talked a little bit about this, particularly in New Hampshire, but I wanted to kind of ask you broadly, how important are organizations like the Urban Institute or the Center here to policymaking process? Why would you argue that a robust policymaking process needs these kind of organizations? And to say, kind of, why not have all this analysis done by a government agency, like the Office of Planning and Research that you worked in, or the Congressional Budget Office, or the Office of Management and Budget at the federal level? Why not just say, this is really important, we should have the government do it?
So just a moment ago, you asked me about the concept of an agenda and ideology. And I believe that there needs to be a democracy of ideas in public policy across all policy topics, just as people believe we need a democracy broadly writ in the political environment. So we need someone on the left, we need someone on the right, we need someone in government, and we need someone in the middle, so that there's enough information out there that they can really understand the various dimensions. So here in New Hampshire, we've got an organization called the Josiah Bartlett Center, which is an organization to the right. We've got the Fiscal Policy Institute, which is an organization to the left. We've got us in the middle. And we've got something called the Legislative Budget Assistant at the State House that does some budget analytics. And legislators look at all three, four, or should, if they don't. So I think you need to have multiple sources of information, is really my answer. You can't just have one organization put it out. You run the risk of missing something because of that one perspective. I read everything that the Josiah Bartlett puts out. I read everything that State Fiscal Policy puts out so that I understand how perspective, and also can sometimes challenge what I'm thinking about things. And so the multiple sources of information are really important.
Okay. Let me ask kind of one final question, some thoughts here. From you is, in my department, health management and policy, some of the students are interested in pursuing health policy careers. What advice would you give them? Where should they be trying to get their first jobs? And what further education should they pursue? And ultimately, what kind of opportunities are out there today in health policy or policy in general?
Yep. Well, the first thing I'd say is wherever you think you're going to be today is not where you're going to be. All right? There's only one person in my graduating college class of my small College of Social Studies, which was 40 people, has the job they thought they'd have at age 47. So be open to a divergent path, I would say. You're better off taking a job with someone who's going to teach you a great deal or an organization that's going to educate you where there's a career path than you are to stick on one path to a vision of the future. So that's my first piece of advice. 2, in the health policy world, I can't say again more clearly, state government is a great opportunity for early career development. And there are amazing opportunities for individuals that you would never get in another organization. Obviously, hospitals, health systems are going to be looking for analytic capacity, and organizations, every university seems to be developing a think tank around healthcare. So there's going to be opportunities in the university system as well. But if you're actually interested in a policy career, state government is a great place to begin.
Okay, great. Well, thank you so much for your time today.
It's been fun.
You've been listening to the Health Leader Forge, a joint production of the College of Health and Human Services at the University of New Hampshire and the Northern New England Association of Healthcare Executives. Please go to our website, healthleaderforge.org, for more information or to leave comments about today's podcast. Look for Health Leader Forge podcasts on iTunes, Stitcher, SoundCloud, and other podcast distribution sites. Thanks for being a part of the Health Leader Forge community, and we'll talk with you again in about 2 weeks.